I'd like to divert my question to Professor McPake. Correct pronunciation. Could you share with us how it is done in Australia?
Definitely not. So I should explain that I've been in Australia for 1 week and I'm not ready to express any expertise on an Australian basis. My background is that I have been working out in the UK for a very long time and with an international focus. So I think I'll reflect more internationally and pick up on a number of the things that have been said already during this panel, but also on some of the questions that we were directed to in advance. Because I think this last point that we were just raising about research that particularly serves particular donors' interests, doesn't address the breadth of the issues, also interfaces very nicely with what we were saying at the beginning about the interconnected systems elements. And I think too much research that we do focuses on just one of those elements and asks questions as if systems were not interconnected, as if you could put a wall up around the question that you're asking. So a question, for example, about the TV program might well be about how effective is the TV program, how many people does it reach, what's its impact on TV prevalence, what's its performance for people who are already suffering from TV in terms of whether they recover and how quickly and so on. But when you ask a question at the systems level, you have to ask it in terms of how does this TV program affect the delivery of healthcare for everybody with all kinds of conditions, and preventive and promotive and curative altogether. And a very lively question around this in the last 10 years has been the impacts of HIV treatment programs with all the huge resources that have been available for those for the rest of the health system. You can ask the question in terms of how many HIV patients have they reached, what impact has it had on their lives, has their CD4 count been controlled, and so on. Or you can ask the question about how has the programme changed the distribution of the activities of the health workforce of the country. How has it affected the drug delivery systems of the country? And you get some very different answers. So that leads us into, suppose you have done some research like that. Suppose you have done some systems research in the health policy and systems part of the research that we're talking about. What then has to happen to make your research useful and helpful? And I think Professor Barun has come up with a number of very good examples of how in some cases health systems research in India has been taken up and used directly in policy. But I think if you're a health systems researcher and you think that's the model that you're operating in, if you're going to do some health systems research, someone's going to read it, and their policy is going to change because you found something rather interesting about how the policy is working, then I think you'd get very depressed. As Professor Barun says, perhaps most things are not directly taken up in that way. And I think we have to understand the impact of the kind of research we're doing at a level above that. So if we're doing one of the many research projects where nobody's really reading what we wrote, nobody's listening, maybe what we're saying is uncomfortable, does that mean we're a waste of time? I think absolutely not. I think health systems research, health systems and policy research, is most useful when it challenges what we think we know, whether it immediately changes what's happening on the ground or not. I'm going to give you an example from the UK, a very old example from the UK about this. And later I'm going to give you a more recent example from the UK. But many people will have heard of the Black Report from the early 1980s in the UK. And I think until the Black Report, which drew on a large volume of research that had been conducted for at least a decade before it was published, people in the UK believed that we had a very equitable, effective health system that treated everybody the same. And that was what we all thought we knew. And then the Black Report came out and it showed us that although we did quite well in relation to those objectives, actually our health system was skewed in favour of serving the middle and upper classes, that they were getting more out of the system than poorer people were, and for specific systematic reasons. Well, that report was extremely unpopular with the Thatcher government at the time. It was shelved, buried, forgotten about. But nevertheless, it changed the way we all, outside that government system, thought about how our health system was performing. It challenged health systems researchers in the next round to ask a different set of questions about why those outcomes were less equitable than we thought. And over a generation, an understanding emerged about how to make our health system more effective and equitable that I think has, in the long run, as new governments have replaced old governments, had impacts on how the health system has continued to be reformed and to be shaped. Not to say that all those reforms and all those further measures have been in a positive direction, because research is not the only thing reshaping health systems. And so another example I'll give you a more recent one, but when the UK's current government, the coalition government, came into power, they very much took as their starting point that the National Health Service was highly inefficient and ineffective. And they took the view that everybody knows this. And their supporting media generally echoed this idea. We all know that we've got an inefficient, costly, ineffective health system, don't we? But actually, there's a whole bookcase of research saying something different in people's shelves. And the debate that emerged contrasted that, we all know this, don't we? And we are from the Conservative press, with a body of research that showed that actually the National Health Service was quite efficient. We made international comparisons and took into account the best type of adjustments that we need to make for understanding how productivity can be measured. We look pretty good in terms of efficiency, and they weren't able to sustain the arguments in the serious press, at least, that the NHS is inefficient and ineffective and rubbish, and we have to reform it. It didn't stop them reforming it, of course, but I think, again, it changed how people understand what's really happening. And I think that's health policy and systems research at its best. The second question that then needs to be asked is what kind of institutions support that kind of process whereby, even without the politicians necessarily being comfortable with what researchers are telling them, the research finds its way into policy change anyway. And I think there are a number of different kinds of institutions and ways of embedding things in institutions that can work. And one that we will often hear about in the conversation is how the Thames do things. The Thames have an absolutely brilliant system of capacity building for health policy and systems research, for embedding those people whom they've built capacity in government systems, and in very directly building their health policies around the research that those people are doing. I don't know any other country in the world that does anything like that, and it's incredibly effective, and it would be lovely to think that the Indian platform would be the stepping stone towards a similar sort of system here, because in many ways that's the ideal. But I think the reality for most countries is that it's never going to be that straightforward. That politics and researchers are always going to rub along a little more uncomfortably than that. And therefore I think that the institutions that are going to make health policy and health systems strong in most countries are really the systems that are going to invest and strengthen the health policy and systems research community as an independent voice separated from politicians. And I suspect that the realities of India would point you more in that direction. It's about a very different sort of society than the realities of Thailand. So if we think about the kinds of institutions in the UK and the US, for example, that strengthen health systems and health policy research, strong government funding, but through agencies that are protected from political influence, we can see the kinds of processes by which communities of researchers, and research needs to offer people careers that are worth entering for the brightest people to enter them. We can't have them as second-class sort of cabals of people sitting on the edges without resources because they've failed in other careers or something like that. There has to be a good, strong sense that a health systems research career is a respectable and worthwhile thing to do. And when you can do that and you can protect it from political influence, it can play the kind of role that is long-term, with major time lags, but that does have a long-term developmental impact on the health systems that it's in.